Okay, good morning, students. Today we'll see on interesting topic because of we have faced the issues for in our India. Now the white fungus and black fungus and yellow fungus, which is the more dangerous for them, especially black fungus. We are saying micromyosis. We are saying legs for them. So how can we see one by one? You know very well COVID-19 and fungus. First of all, you know very well the COVID-19. Now the second way of going to there our India, we are facing the issues related to for them. But still, last year you know very well first way how to affected, second way also there we are getting anyhow. God grace we are take vaccine also, but COVID-19 pandemic, we have facing some another issues. For example, black and white and yellow fungus waves in our nation also should be affected so many states. For example, as India battle hard the second influence of COVID-19 pandemic, that is a new parasitic disease for gun of for them. Especially government is request to for them state to alerted for them to take care about the contamination related whatever the your precaution taking for them, that everything will given for them. Next one is about the fungus. You know very well fungus is what is that. That your uh, that related will see what is micromyosis. For example, black fungus micromyosis is a dangerous illness which is has been contaminated for COVID-19 patient. For example, COVID-19 patient who was reoccupated for the patient is who is already they are affecting with COVID-19. They're again their recovery from there. Again, their few days they have again they come for the affecting with the black fungus for them. The present they, according to the climates and situations, and same time environment is one of the major causes for them. We'll see one by one. Next one is what is yellow fungus. Yellow fungus also infection is mainly caused to the bad hygienics, especially highly construction yellow construction area. Suppose any building like yellow organism means any, for example, moderate wounds will be happening, any genuine causes for them, especially any injury for them, any cell injury, that like organ, any disappointment, that like will happen for yellow fungus. Next one is white fungus. White fungus means what? White is the growth, is a uh, dark passage legs. For example, this is a body to seriously harm to the especially our lungs, extremely impact for the kidney, mouth, and skin and cerebellum. This all thing organs should be affecting for them. That is the main thing for the white fungus. What is the causes? Because we don't know what is the causes for this disease. First causes is for both black and white fungus is caused by the micromycetes. For example, presenting the environment. Already I told environment is one of the major causes to impact for our lungs organ, extremely our dangerous for them. Next one is unsanitary environment, means unhygienic, like unhygienic you are following for them, and food and water and hygienic habits that will be happening for them. Next one is prolonged steroid. If you take more steroid, why that I already told, because of COVID-19 patient they're taking more steroids, so that patient have the that's only they have faced the issues of black fungus. You see that I think you see the search for them, you see the picture of black fungus. I think you already see. If you not see also, I will show you. So black, that is a prolonged steroid treatment for them. For example, continuously if you take the steroid for them. Next one is diabetes, especially diabetes ketosis, that the main reason for them, that is causes for to happening for this legs. Next one is causes of serious problems. Somebody is having serious problem with the, for example, COVID-19. That person already for them. That this is one of the major causes of to the black fungus. That is the reason only black fungus affecting for the COVID-19 patients. I am saying for them because of steroids. Next one is the who have the lesser immunity. Their body have no immunity, proper immune system, means they have affecting for the comorbidities, especially our health issues for the immunity. One of the major problems having HIV/AIDS already known that also already they have facing the problem, that patient easily should be affected. Any any kidney failures or renal damage or failure, that also one of the reason for this all thing causes of black white fungus skin. Next one is comparison. How the symptom is there. For example, first column symptoms. Next second one is black, yellow, white. First one is one side facial swelling. For example, that is see in the black fungus. No in yellow and white. Second one is headache. Headache you can see for the black fungus and white fungus also. Especially this, I already told that facial area. Our face, no, that facial area. That is a more affecting. That's only told if you have affecting the black fungus, immediately to visit the ENT doctors for them. Nasal or sinus consumption will be happening for them in the black fungus, and black fungus especially the upper inside of the mouth will be happening for them. That also one of the reason for them. Third one is blood, heart and chest pain, and brain brain that also one of the reason for them they happening for them black fungus. For example, black part, chest pain, brain, eyes, bones, and other body of the part land they will be happening for them. This type of facing the issues for them. Black head, chest pain, brain, eyes, bones, that line our body that will be happening for them, especially white fungus. Next one is low immunity. That is the main thing of three things. One is for them low immunity, what like now, for example, they have black, they have happening for them low immunity, who have having low immunity for them, especially black fungus and white fungus and yellow fungus, both are having these issues for them. Next one is diabetes due to the use of steroids, for example, most steroids taking for them are diabetes, that like black fungus, yellow fungus and white fungus like we can see. Next one is comparison of symptoms. For example, coughing, fever, diarrhea, dark spots, lungs in will be happening for the especially white fungus. White patches is a oral cavity, skin lesions. For example, the oral cavity like the happening for them. That is a white fungus like we can see. Next, do not show the external symptoms. For example, they never show some external symptoms for them. We cannot some see, for example, white fungus we cannot see for the type symptoms. The internal should be affecting for them. So next one is extremely tiredness and weight loss and loss of appetites will be happening for them. What like means they have extreme tired, loss of weights, and poor appetites for them that will happen for the yellow fungus. Next one is leakage of pus, internal bleeding, soul of healings and wounds and scans, sun eyes. This all happening in the yellow yellow person symptoms for them, yellow fungus. Next one is face, nose, eyes, orbit, and even brain also that will be happening for them. This type of happening for the uh, black fungus we can see face, nose, eyes, orbit, and brain also we can see. Next one is under some symptoms also is there. Burning of vision may problem they're facing, toothache, the pain for them, chest pain that will happen for the black fungus, especially breathing less difficulty you see in the black fungus and white fungus, and bleeding will be present in the black fungus, and discharge from the nose also present. Already I told, no, especially the facial area. So they have black fungus will be happening, and facial pain will be there happening, and swelling and numbness, that all thing will be happening in the black fungus. And double vision or water eyes will be happening for in black fungus. More dangerous is means compared with this three. Black is very more dangerous and white is more dangerous compared with the yellow, because of the black and white fungus is severely to affect for them. Next one is another symptoms for them, reduce the oxygen level. For example, their white fungus they have main problem for the reduced oxygen level. And next one is lethargy, that is will be happening for the yellow fungus, and necrosis will be happening for the yellow fungus, and organ failure and slow healing all wounds, and poor nutrition, malnutrition in the you can see in the yellow fungus, and slow healing of all wounds that also happening for the yellow fungus. Especially lungs should be affecting the black fungus and yellow fungus also. And the impact of brain and respiratory system, digestive tract, that all thing will be affecting for in the yellow fungus for them. This all thing we can see for them. This type of symptoms we can see for them. So diagnosis for them, physical examination first they can do for them, and the medical history should be collected from the patient. They have previously any should be affecting COVID-19 that related, they can check for them. And biopsy, if they take the biopsy from the patient to check them, and CT scan for your lungs especially, what is the lobe for the check the lungs, how much is the score, their level of score, their lungs, they will be checking for them. For example, 5% according to they given both lungs, they have checking for them how much affected your lungs, they have scoring according to, for example, 100, how much they getting score for them. So that much of lungs affected, that much of according to they given for the treatment everything. Next one is swab and tissues, that all thing for the will be happening for the diagnosis evaluation. These all things we can will see for them. The remaining we'll see the next upcoming